It seems like everyone is talking about ADHD these days, and some people see ADHD just about everywhere they look. So the biggest problem with that is perhaps that sometimes symptoms that are related to another condition might be mistaken for signs or for an indication of ADHD. And when that happens, it could mean that you receive the wrong diagnosis and that you then receive a treatment that is either not necessary or not optimal for your condition. So I thought I'd take a few seconds to tell you a little bit about some of the symptoms that might actually help you distinguish ADHD from other conditions. So maybe I thought I'd start with GAD, or Generalized Anxiety Disorder. And this is essentially a condition that involves excessive and intense and ongoing anxiety and worry that definitely interferes with a person's day-to-day life. And so it can sometimes look like ADHD because in both cases, well, the individual may feel on edge, or they may feel fidgety or anxious, and so on and so forth. However, in ADHD, it's perhaps less usual to have the intense and truly uncontrollable worry that you find in ADHD, at least not for a period of 6 months or more, which is what you need for a diagnosis of GAD. And it's also less likely to see in ADHD that anxiety that we will find in GAD about medical conditions, like an intense, for example, an intense fear of having cancer or some other medical and life-threatening condition, which is more typical of GAD. Another condition that can be mistaken for ADHD is depression, and that's because it's not all that unusual for people who have ADHD to also have depression. But unlike in depression, people who have ADHD will not have that general psychomotor retardation or that slowness that is more typical of depression, or they won't have the low levels of energy that are also more typical of major depression. Another condition that can sometimes look like ADHD is bipolar disorder, or even borderline personality disorder. So this is a potentially difficult area for diagnosis. In ADHD, unlike in bipolar disorder, you will not have as much of those quick cyclical changes. And you also won't have any of the psychotic-like symptoms, of course, like hallucinations and delusions. You also won't have the significant decrease in sleep that can often be present in bipolar disorder. Now, as I mentioned, ADHD can also sometimes look like borderline personality disorder, partly because both can involve a sense of unpredictability and chaos, but in ADHD, the abandonment anxiety won't be at the forefront like it is in borderline personality disorder. And you also won't have those very rapid fluctuations in mood that you can have in BPD, borderline personality disorder. And you won't have the symptoms that are psychosis, like dissociation. And finally, you won't have that identity disturbance that is quite typical of borderline personality disorder. So there are a number of conditions that can look like ADHD, and some of these are psychological, and I just mentioned a few, but there are others as well. And others are purely medical, just for example, lead poisoning, anemia, both can lead to ADHD-like symptoms. So it's very important to be properly assessed if you think you have ADHD and if it gets in the way of you living your life. If you completed a screening test and it suggests that you may potentially have ADHD, keep in mind that these tools are just used and they were designed for one thing, and that is to screen. They're simply not enough. It's not sufficient to make a proper diagnosis, so you should not accept the treatment that is offered to you based only on such screening. So just go get tested properly by a professional.